Hi guys, Michelle Knickerbocker here, your local expat that moved to Costa Rica over a year ago with her lovely wife and 3 dogs. And today I'm coming from Santa Ana, Costa Rica, which is outside of San Jose. My wife and I are here for the Easter holiday weekend just to get away for a couple days. And so while I was here, I thought I'd talk to you a little bit about health care and maybe touch on dental care a little bit here in Costa Rica. Some people know, but I am dentist back in the United States. I mean, I'm a dentist all the time, but I don't practice currently in Costa Rica because I do not have my Costa Rica license. I can get it. All of my credentials and education in the States would allow me to get my Costa Rica license, but at this time I don't have residency, and that's needed to work. And I also have not passed the fluency exam for Spanish. So I don't speak Spanish fluently. I'm getting there, but it's a process. So that's why I'm not currently practicing here. That being said, I have checked out some dental offices and some medical offices in the San Jose area, as well as who we go to out on the southern coast. We live outside of Dominical. Please understand, Costa Rica is the size of West Virginia. And so, sometimes when you live on the outskirts, like we live in a coastal town, we can get services there. But sometimes you might have to drive into San Jose, which is about 3.5 hours away, if you need to have like a surgery done. I mean, there are hospitals in other places, but San Jose is like the main hub. So if there's something specific, like a lot of people will come in for medical or dental trips here to Costa Rica because the cost is such a significant difference. Trust me, I know. I used to have to charge it and to keep my office above water. I bet you crowns in the States, I don't know. You tell me, how much is a crown if you have to go to your doctor and get a crown? I bet you they're at least $1,300 in the States. I bet you they're more than that. If you want to know the truth, I'm being really generous. They're like $600 here, maybe. Fillings, $50 to $100. Cleanings, I don't know, to be honest with you. I've seen teeth whitening advertised for anywhere from $100 to $300. Here's the thing to realize, though, guys. This is not a third world country where education is not a thing, or education is not, I don't even want to say valued, but education is not attainable. Education's attainable here, and it's valued here. And so they offer wonderful work. Example, there's a dentist here that does beautiful work. He does reconstructive work. He does like full mouth rehab. So if you've had people that you've seen that just really need an overhaul, and in the States, I'm not kidding you, it's upwards of $30,000 to $50,000 when people need implants and a full mouth rehabilitation. He's doing down that here for $10,000 to $10,000, $8,000. It's insane. And you might say, yeah, the quality's less. Yeah, it's not the same. No, it's the same, you guys. It's the same implants. It's Straumann implants. That's what I worked with in the States. It's the same exact stuff. And you say, oh, well, they're not trained the same. They're trained better than I am. I went to the University of Detroit Mercy. I then trained at Northwestern Memorial Hospital for my residency. And then I was a general dentist for over 20 years. This guy got his original bachelor's degree in dentistry down in South America. He got a dental degree from, I believe, NYU, and then proceeded to get his dental degree again down here in Costa Rica. He's a member of all of the associations, the dental associations in Costa Rica, as well as the American Dental Association. They stay on top of everything. They offer the standard of care. The reason they're able to keep the cost down is, I don't know if you realize this, but the cost of dental supplies is different around the world. And not only that, he does stuff like he has his lab in-house. So if he keeps his dental lab in-house, he can have these patients come in and have everything done and know exactly when they're going to get their treatment, when their denture or their partial or their crown or whatever they need to have done, or their ortho aligners, whatever. They're all made in his building. He has control over that. And so he can dictate how fast it goes and how slow it goes. And they're not overwrought here and saturated like in the States, where it's like every 10 minutes you've got another patient. You got to go, because it's all about getting that count, that patient count in, and seeing as many people as you can. It doesn't matter the quality. It doesn't matter that you're going to see a doctor, and just because they're your general doctor and you're like, hey, I think I have an ingrown toenail, they're like, nope, got to send you to the podiatrist. I don't have time for that. I might be a doctor, but I'm not a podiatrist. You got to go see a podiatrist. It's just bullshit. That's not how it is here. This is like the olden days where they sit down with you. Like we went, my wife and I, we made our appointments to see our doctor. I'll just be completely honest. I am going through menopause. I am perimenopausal. I need hormone replacement therapy. I was interested in bioidentical hormones. We made an appointment at our doctor, and we were like, well, can't we just come together? They're like, no, you need your own appointments. Okay, fine. It was over an hour of just talking. I haven't had that. And I had a fantastic doctor in the United States, and I loved my doctor because he fought the system and still would listen and try to take as much time with us, but it just was getting so bad. I was with this lady for over an hour talking. She never once even wanted to examine me. She just wanted to listen to me. What was I struggling with the brain fog? And I have an itch in my ear, and I can't sleep, and I have night sweats, and I feel like I'm going crazy. And she listened to all that. She's like, yep, that's all could be fixed with this. So I don't know. It's just night and day. It's just like living on a totally separate planet. And it's like, what? I don't know. I feel like I'm rambling as always, guys. But if you have any more questions, just let me know. But it's beautiful here. The healthcare is amazing. The people are wonderful. I feel like the care that I've received here in the last year has been better than the last at least 15 years in the States. And that's not dogging on the medical community or the dental community in the United States. It's dogging on the administrations and the political games that they're playing when they have privatized hospitals and privatized clinics that all they care about is the bottom line, and they don't care about the people, and they don't care about helping people. All they care about is making the dollar. My parents were nurses that worked at a Catholic hospital their entire careers. They worked for nuns at the beginning. They never turned a person away. They gave out turkeys and free meals on the holidays, and it was a wonderful place to work. And then it became corporate. It became Trinity Health in Muskegon, Michigan. And it became about the bottom line. And if you ask anybody that worked at Mercy Hospital in Muskegon, Michigan in the 70s or early 80s, and then they worked there and continued and saw the change, it's just an absolute disgusting travesty what's happened to healthcare in the United States. So that's my spin on it as a 48-year-old cis white woman who is now burnt her whole life around and left the country. Costa Rica, baby, pura vida. Hope you have a great day. Find a reason to smile. Be kind to one another because it's free. And be safe out there, guys. We love ya. Bye.